Well, we're back with Dr. Fong. Dr. Fong, let's talk about missing teeth. And mainly about, when I now talk about missing teeth, most of the time they're like in the back. You see, when us patients go to a dentist and we have missing teeth in the back, and the reason it's in the back, because in front, none of us has any problem going to a doctor, the dentist, and getting them replaced because we just simply look too ugly. However, in the back, not so much. We patients don't see a danger. Well, it takes a week or two to get used to chewing on a different side. No, not really. Doesn't look like a big deal. And yet, you dentists keep telling us, you've got to replace them. You've got to put something in there in the space where this tooth is missing. Otherwise, all havoc will break loose. What is that all havoc, and why is that we don't feel like that, but you guys feel like that? Does it have something to do with like a car mechanic who just wants to put a new transmission in it to make more money? I mean, what's the deal here? Shed some light on it, please.
Well, I believe the first reason why many people don't feel that it's important when they lose their back teeth is because they simply think that it doesn't show when I talk or smile. But the reason why we believe that it's important that they consider replacing or fixing those back teeth is because those are the teeth that you need to use in order to chew. And if you don't have those teeth to chew, you're not going to be able to enjoy a high quality of life. Second of all, the reason why those teeth are so important and should be restored or replaced is because if you don't, what happens is it leads to additional jawbone loss. And when you start losing the jawbone over time, and this will probably take over the course of 5, 10, 15 years, then that jawbone becomes thinner and thinner. And as we get older, if the bones get brittle, they can simply break. Second reason why is because if those teeth are missing, especially if it's missing in between two other good healthy teeth, what happens is that those adjacent teeth will begin to migrate or move, or the tooth above that space will begin to shift down. When that happens, that reduces your window of opportunity to have those teeth replaced. And so when that happens and you don't replace it, that crowding or that shifting can lead to jaw joint problems. It could lead to gum disease, which creates a deeper pocket. That could lead to inflammation and gum disease settling in, which could also result in the further loss of additional teeth. So the reason why we feel that that's important is because we're trying to keep a nice, stable bite for you to be able to eat and chew. We're not trying to encourage you to spend more money, but we want you to understand that there is a reason why you are given those back teeth, and that is to help you to be able to chew in harmony.
Well, it looks like, Dr. Fong, that to a certain degree, and that's probably what is the truth, that while yet you make us spending money, you're saving us money in the back end, because if all of a sudden 2 or 3 more teeth are missing, like a fence pole, you have a fence, in the old days you had those little, each, I don't even know what you call those things. Anyway, you have those fence poles, and 1 or 2 of them get loose and they become crooked. They lose their functionality, never mind that they also look ugly. And yes, chasing fence poles, they get crowbarred out. That's basically what you're saying. And the whole in the back, that's those teeth start playing piano, don't do the job anymore, and push. Can they push even some front teeth that they then become a little crooked or start falling out? If exaggeratedly, is there a large problem?
Absolutely. Over time, that could lead to additional crowding of the front teeth because the teeth are trying to find its neighbor to create some type of stability with one another. Yes.
And you said something about, and I can think with that level, having originally been a mechanical tool maker, an engineer kind of, so I work with cogwheels and stuff, and if there is one tooth in a cogwheel missing, for a while sometimes it's okay, but eventually the machine will come to a grinding halt. And it looks like what you describe in the teeth. They go all over, and then you get those jars here because you bite badly and wrongly, and only you use one hinge, not the other one, because you're not balanced, and the teeth become crooked. And this jaw here, which apparently is one of the most complicated jaws in the body, gets having a problem. And isn't that what can cause severe headache, migraine, back pain, shoulder pain, and stuff like that?
All those symptoms that you just listed are what could happen if the teeth are not replaced or restored. Yes.
So the teeth missing makes for bad eating, bad chewing, and lots of people will write that off as so what, I kind of chew and swallow anyway. But then there is that the teeth are shifting, and by doing so, they become all crooked, and other teeth will be lost because of it, because they kind of like squeeze them out like a crowbar. And then there's the fact that you lose your jaw bones, which once you lose a jaw bone, because the jaw bone doesn't feel like growing anymore because there's no more tooth there. There's no reason for it to exist. But when that happens, it's difficult to replace the teeth. And is by the way, the loss of jaw bone, is that why people have this dried out tomato look? You know, they look like an old lady, an old guy, old person.
You're right.
Yeah. So
right, as the jawbone begins to atrophy, the thickness of the jawbone becomes thinner and thinner. And so yes, it gives them that effect.
That caved-in feeling. And then there's the fact that perhaps it will move your jaws and you get headaches. So there's lots of side effects which obviously we don't want. So apparently spending a few dollars to fix it isn't such a bad thing. Thanks for explaining this so well, because there's a difference between, it's all bad and the situation will get worse. What worse if it doesn't hurt that much, if it's not having that much effect? But you now did explain it, what that worse is, and I don't think any of us really wants it. Thank you very much, Dr. Fong.